Bowen therapy for feet. When we're working on a foot, we're going to be addressing the whole of the lower back, the pelvis especially, the knee, and all of the muscles underneath the calf muscles, which include on the outside of the leg the peroneus and on the inside the tibialis. These muscles become tendinous and then wrap around to the underside of the foot, attaching to the navicular and the cuneiform and the talus, and becomes the stabilizers for the arch of the foot and the propulsion that the arch creates. If we look at the underside of the foot, you can see how those muscles and tendons interact with the toes of the feet, and this is what allows the foot to propel itself from its gentle movement. And a lot of issues will arise from having poor foot movement and poor foot posture. The bones of the foot include the medial sesamoid, which is at the joint of the great toe, the metatarsals, the phalanges, which are the toes themselves, and then the cuneiform, the navicular, and the talus. So these are the important bones to know about in the foot. And these are all flexible and move. The plantar muscles stabilize the foot from the underside, but these have a lot of contraction, and they have to work quite hard to stabilize the movement of the feet. And if your posture isn't correct from the hips downward, and at the knee as well, or the ankle even for that matter, then these muscles are going to contract and become tense. And here we see plantar fasciitis, for example. So the ankle procedure is what we're going to demonstrate first in this little preview of the footwork. And we're going to see the 5 moves of the ankle procedure. Move 1 at the ankle, move 2 and 3 on the outside ankle, the malleolus, move 4 on the medial malleolus, and then moves 5 with a holding point at the malleolus. So moves 2 and 3 are performed at the distal margin of the lateral malleolus using the index finger, slack onto the malleolus, the ankle bone, and then move through the groove that is created by the malleolus and the talus, and then slack towards the top of the foot and move towards the calcaneus for move 3. Move 4 is done with the thumb, and it's performed by taking slack towards the top of the foot, gentle challenge, and then move towards the heel, the calcaneus. When we work on feet, you're going to notice that there's a lot of different procedures that can apply tape to support the effect of the treatment itself. And we're going to be able to do that for the ankle procedure a lot of times. Hammer toes is also a procedure we'll demonstrate here, and that requires tape as well to allow a support, in a sense, for the changing of the alignment of the muscles. Plantar fasciitis is another procedure that can use tape, and this is a wonderful procedure, working very, very effectively, and you'll help a lot of people over a short period of time relieve and cure their plantar fasciitis. We can also do a procedure called heel pain, which is essentially a squeezing together of the fatty pad of the heel using tape. And then bunions, we don't use tape because we're going to use a soaking system, even though they do happen with hammer toes as well. So the hammer toe procedure, move 1 is done with both thumbs, taking slack from the middle of the ball of the foot to the heel, and then challenging and moving towards the toes. Moves 2 are performed with the fingers on the underside of the foot and the thumbs resting on the top of the foot. Slack and release is something that's done. The bunion procedure, as I said, is not done with tape at all, and we're going to use soaking, usually in Epsom salts or some salty water of that sort, to break down the bunion itself. So looking at where the moves are made, you've got to note that that's in the groove between the joint of the first toe, and that's the first metatarsal and the phalanges, the first phalanges. So we do move 1 over the tendon, the hallucis longus tendon, moves 2, our little Bowen moves, breaking down the joint itself. And then underneath we do a breaking of the tension in the joint, the calcification that's there. Let's look at the demonstration now. Now, keeping the foot between your thighs, sitting facing outwardly. Make sure the foot is at 90 degrees and comfortable and easy to rotate. So move 1 of the ankle procedure is just between these large tendons there. Take slack laterally, engage challenge, and move medially over the hallucis extensor. Here's the lateral malleolus, and here is the medial malleolus. So our thumb and finger are just going to be inferior to those towards the distal point of the feet. The finger is going to hold the foot with that part of it, and the thumb is going to have the palm of it touching the foot. Move 2 is take slack onto the lateral malleolus, challenge, and move towards the toes. Move back to the starting point and take slack to the top of the foot, challenge, and move toward the heel for move 3. Return to the starting point. Make sure your thumb is in the right position between the malleolus and the talus. Slack towards the top of the foot and challenge and move toward the heel, like so. Return to the starting point. Hold the ball of the foot with the heel of your hand and secure the toes with your fingers. Flex the foot toward the head while holding comfortably, holding points at the malleolus. Extend the stretch as far as it will go and then do a final jolt like so with your elbows pointing up and down. Now you can do move 1 of the bunion procedure. Take the top of the toe and extend the tendon, and at the joint itself, the hallucis extensor, we move 1, and then using the thumb tip, little Bowen moves for moves 2, and these are going to go through the joint between the 2 metatarsal and the phalanges, all the way around the first joint of the great toe. Can be very sensitive, so be sensitive and gentle with it. A little wiggle or flexing of the toe, make sure it's mobile. And we're going to hold the joint of the toe with our thumbs tip to tip underneath. So they're like this underneath the joint. Fingers hold the toe and the foot, and we're going to flex like so. And you see how the joint opens. Sometimes you'll feel a cracking of the joint. Move 1 of the hammer toe procedure is that the midpoint between the hallucis longus and the 5th metatarsal there, right in the middle of the ball of the foot, we place our thumbs like so, taking slack toward the heel, engage challenge, and move toward the toes. Moves 2 are really performed with the fingers, starting at the toe, the big toe, pulling the ball of the foot, the metatarsal pad, toward the heel. Go from the big toe to the little toe, and then back again at a very minimum. You can do more. And so the feet, when I work on the feet, I do all 3 procedures, the ankle, the bunion, and the hammer toe. And of course we have the options to tape the ankle, to tape the hammer toes, or to tape for plantar fasciitis, or even to tape for heel pain, where we just take a strip and pull together the calcaneal pad underneath by squeezing the tape as we go around the heel. So that's the foot.